We're helping to celebrate Nurses Week here at Fox 24 News Now, an opportunity to recognize men and women who commit to the hands-on care of patients all year round. Let's welcome Josh Moran, Assistant Nurse Manager of Mental Health at MUSC. It's good to have you with us. So tell us more about your specialty.
Thank you for having me with you. Yeah, the mental health specialty is just one of many of nursing, and mental health is important for like whole health. And I know we're recognizing Nurses Week. This is also Mental Health Awareness Month.
Yes, it is. Yes, that is true. You know, there are so many different branches of medicine. What was it about mental health that captivated you?
When I was in high school, I volunteered at a hospital, and when I was in college, I switched from pre-med to psychology. So when I went back to school for nursing, I knew I wanted to be a mental health nurse.
Yeah, and what is a day in the life of Nurse Josh?
We do like different groups. Each person that comes to the hospital like present for different reasons. So it's really trying to individualize care and make it patient-centered for what the patient's hopes and goals are for their time that day specifically, and then while they're at the hospital.
Are these voluntary patients, or are they there at the hospital involuntarily?
There'll be a mixture of the patients. They're voluntary, or if there's like a concern for their safety or safety of others.
Sure, sure. And you know, there's challenges with everyone's job and workplace. What would be a challenge, an everyday challenge that you would meet and overcome at the hospital?
I want to say a challenge that continues not only like at our hospital, but across the nation is about the nursing shortage.
Oh, yeah. Okay.
Yeah, and was it just yesterday, the American Association College of Nursing shared that there's like a decline in enrollment for entry-level nursing programs.
Why do you think that is?
The COVID pandemic has put a lot of burnout and exhaustion and even trauma on the frontline workers, not only just nurses.
It's so important that you bring that up, because let's just reflect for a moment what that was like. You know, when we were all on lockdown and we were broadcasting the show from our homes, we actually spoke to a lot of nurses who were on those front lines, not only exposing themselves to COVID-19 and kind of this unknown threat, but also there to help people who were coming down with COVID-19 and having to get treatment. So that put a huge strain. So you think that maybe that's in the wake of all of that has led people in another direction? You know, it's uncertain for me to be able to pinpoint it exactly. Yeah. I can see where that could maybe make an impact. Certainly didn't deter you.
Yeah, there's new grad nurses that you know will work for a couple years and then leave nursing. So it's really how we can retain our nurses, especially with so many nurses retiring.
Yeah. And becoming a nurse is not easy. How many years did it take you?
Well, the ABSN program at MUSC is an accelerated program, so it's about almost like a year and a half.
A year and a half. Well, it is an investment of time, but like you said before we got started, it takes someone who has compassion and wanting to care for patients, and you certainly do that on a day in and day out basis. Josh Moran, I want to thank you so much for joining us today.
Thank you.
It's been a pleasure. We're back after this.